Hi, and thanks for joining me for this Advisor Insight business case. I'm really pleased to have Ari Magalhaes with me. Hi, Ari, how are you?
Hi, I'm well, Penny. How are you?
You're very well, thank you. We'd like to ask you to share, firstly, a little bit about yourself and your background and what's led you to being in the advisory space, please.
Yeah, absolutely. So I'm an economist, transformation and turnaround specialist. I have over 15 years of experience across several sectors, but particularly in health, energy, and human services. I'm from Brazil, but I've worked globally. I've worked in Europe, South America, and I've been in Australia for over a decade.
Fabulous. Thank you. And if you can give us a quick overview of the business case study that you'd like to share with us today?
Yes, I work with a large non-profit organization that is very well established in the disability services space, but they were going through financial challenges and acknowledged the need to diversify their portfolio, but were not sure how to approach that.
Okay, fantastic. So if you can share, I guess, and I think you've hinted at the driver,
Yeah.
the business case driver for going ahead with this advisory engagement. But if you'd like to, I guess, confirm that for us,
Mm.
and then share a few details for us, please, about what was involved in the engagement for you as the advisor.
Absolutely. The drivers were two core ones. The first is around the financial sustainability of the organization. And the second one was around risk exposure. In the NDIS space, there have been a lot of regulatory changes and increased regulatory scrutiny, and the reliance on a single source of funding increases risk. As a result, I initially came on to support through a business diagnostic, understanding the current state internally. Then the next step was to understand and develop a growth strategy, understanding the potential markets. Should we go into private health insurance, partner with hospitals, providers, Medicare, aged care, etc. And we evolved that to really and it was decided in partnership with the executives and the board
Yeah. So who were
to
you predominantly advising and working alongside?
the CEO, the COO, and the CFO. So we worked very, very closely, regular meetings, and in-depth validating assumptions, going through modeling, going through SWOT analysis. Also had regular meetings with the board to keep them to make sure that we were on the right track and got their input in critical decision making time points, and really also occasional meetings with the leadership team to make sure that whatever decision we were making around the structure and the advice that had been defined was flowing through to the
Yeah.
front line.
Okay. And where did the outcome was there an outcome? How long
Yes,
were you engaged in the
um,
project?
18 months.
Right.
Yeah. So,
Okay.
and it was we had it's a outcome in progress, but very good. So it has been we've decided that, or the organization decided that they were going to solidify their presence in aged care.
Right.
We looked at assess their customer profile, so they have a very large cohort of seniors. They have the expertise in regulation. They have the connection. So we have developed that now a 12-month roadmap to establish that those foundations they need to get into the aged care space.
Fantastic. Thank you for that. Now, we refer many of these case studies back to our best practice principles and our best practice framework, and I think this is a really interesting example of one or two of those key
Mm.
principles. Are you happy to have a chat with me about those?
Yes, the principles were overall very well implemented, and the project was very aligned with those. But I think the two main ones were one, the clarity of scope.
Yeah.
Despite me explaining that there have been shifts, that it has evolved. So at each step, when there was a shift from a business diagnostic to focusing
Growth
on the growth
strategy.
strategy or the business model, we revisited a contract, they've revisited the advisory scope of work and had
Yeah.
very clear goals to align with that. And another principle is the one around structure and discipline, which naturally flows on from having a very clear scope of
Yeah.
work, regular check-ins, reporting, and measuring key performance indicators, controls to
Yeah.
make sure that we were on track throughout the process, throughout the project. Yeah.
Fantastic. Ari, this is a really interesting. It sounds like it's been a really well honed and executed advisory engagement, and it'll be really exciting to see how these next 12 months progress with the roadmap. But thank you very much for sharing today that case study with us.
Thank you, Penny. It's been great.